Hello there, my name is Yudi and this is the Yudi Factor, a program that understands that knowledge is power. And therefore week after week we discuss issues and empower you with information to enable you make informed choices, especially when you factor in something you heard on the Yudi Factor into your situation. Most women will thank God for concealers, yes, even more. Because if some of us take off the makeups on our faces, you're wrong. I have this mark on my face and I went to see a dermatologist. And the dermatologist told me I had melasma. I'm like, what is melasma? And I found out that a lot of women have that problem, even men too. Some people think it's maybe you used cream and you got burnt from that cream. But today I have a dermatologist who will be talking to us about melasma, why we have it, and what we can do to avoid melasma. My guest is Dr. Olushola Anyalowo, consultant dermatologist with Luth and a senior lecturer, University of Lagos. She lectures on dermatology and genitourinary medicine. So she'll be talking to us about melasma. So what is melasma? And why do we all have it, especially black skin? Don't go anywhere. We'll be right back. You're welcome back, Dr. Olushola. You're welcome.
Thank you.
Thank you for coming to empower us with information at such short notice. And today we're going to be talking about melasma. What is melasma?
Melasma is a term we use for blotches and patches on the face. And that it's quite prominent on the cheeks, on the forehead, on the chin, and the tip of the nose, those areas that come out on the face. It can occur in males and females, but it occurs in 90% of cases in females. And it can occur in all races, but it's most prominent in people of dark-skinned, Africans and Asians.
Why do we have melasma? Because I have mine on my cheekbone.
Okay, there's so many factors to having melasma. The most important factor is the sun exposure. A lot of us take it for granted that we live in Africa, we're used to the sun, and so we just enter the sun. Continuous and prolonged exposure to the sun can give you patches and blotches on your face. Of course, most commonly it's also found in pregnancy. In pregnancy, we can also call it cloasma. You notice that when some people are pregnant, they get darker on their face. It could be uniformly dark, it could be patches and blotches on their face. And as soon as they deliver, some weeks after, the face smoothens up. And then sometimes when people are under intense stress and pressure, they can come out as blotches and patches on their faces. And of course, certain drugs, particularly oral contraceptives that contains estrogens, can give melasma. Of course, and then people that are menopausal, they use estrogen sometimes for postmenopausal symptoms. They can also have melasma when they are exposed to sun. So the single most important factor is the sun.
Because now that you're talking, I used estrogen cream, and now I realize that that's it. So what can we do? Because you find out that past about 5-6 women, even younger girls, you find that with this patch, and it's always around the cheekbone, around the eyes, around the... Is there a certain lifestyle to it?
Well,
to avoid it?
Melasma, of course, usually starts from 15-year-old, and it comes in most in the reproductive age till mid-40s. And that starts to reason, because that's the time we are on the road, in the sun. The student is going to the school in the sun. So the most important factor for melasma is sun avoidance.
So sunscreen use cannot be overemphasized.
It can't be overemphasized. Apart from that, the sun is at its highest between 10 o'clock and 2 o'clock, 2 hours before and after midday. If you can avoid the sun as much as possible at that time, you can minimize the probability of you having melasma.
Can it be treated? Because I have read about it, have tried to research on it. Can it be treated? Because mine, when I treat mine, it goes and comes. And like you say, when I'm under stress, it comes back. It clears, not completely, but it keeps going and keeps. Is there any way we can treat melasma and get rid of it? Don't answer that question. You'll answer when we come back. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, my guest is Dr. Olushola Ayalowo, consultant dermatologist with Luth and a senior lecturer at University of Lagos. She lectures on dermatology and genitourinary medicine. Our topic is melasma. That's the dark patches you have on the cheekbone, forehead, nose, chin, and I'm a candidate, and I know a lot of you are candidates too. Thank God for concealers and thank God for makeups. So, doctor, is there any treatment to get rid of it?
Okay, the major treatment starting is preventive. Now, the process is we need to do sun avoidance. As much as possible, we don't dose high sun time, usually 10 to 2, 3 o'clock. As much as possible, you need to avoid the sun. You can also use sunscreen. Now, it's assumed that we live in the tropics, we're so used to the sun, we enter it, it's our lifestyle. But if you need to be in the sun at those top height sun time, you need to use sunscreen. So even your sunscreen can start from SPF 50 plus. Particularly if you have a tendency to having it or you have been treating it and it's been coming and going. And then you could also use umbrella. We always assume umbrella is only for the brain. Okay. But umbrellas too can be useful for the sun. You could use wide brim hat, you could use scarf, put on a scarf. So the most important thing is the sun. Then there are also creams that you could use to treat it. And there are also procedures, we call it chemical peels. And then, of course, there are different chemical peels that can be done depending on your color, your skin type, and the intensity of the condition. And then, and that you need to do over time, not just a one-shot procedure. You might need to do it like 6 times, 8 times. And they also talk about light therapy. We talk about intense pulse light therapy. And we also talk about laser, use of laser. There are lasers that could help with the pigmentation. So you could do all of that.
Like if you do those treatments patiently, how long do you think you'll do it to begin to see? I didn't say to clear, I said to begin to see.
Oh, as soon as you start to do it, you can start seeing some improvement. But sometimes these things are not cast in stones. Yes. Because for some people, depending on the level of pigmentation, our skin has 2 layers principally. The pigments can be in the upper layer and the lower layer. And for melasma, most of the pigment is in the lower layer. So if most of the pigments are in the lower layer for your own melasma, it might be slower. But you will start to see something. So the key to it is some patients, a lot of patients with treatment, sticking to your prescription and then with those procedures. It may be one procedure, it might be a mixture of some procedures and some creams that would reduce the pigmentation that you'll be given.
You were talking about sunscreen, and you mentioned SPF. There are some people there who don't know what SPF is. What exactly
Talk
is
about sun protection factor. So the SPF you use depends on your skin type. If you're the lighter shade of skin, or lighter shade, you need very high sun protection factor starting from 50 and above. If you're dark and you don't have too much of exposure to sun, maybe 30 plus. And then in most of our powders we have 15 plus SPF. So it's something that's calculated according to the sun exposure and the color of the skin.
Like when I read about melasma, they said there were different types of melasma, which you have explained. Some are skin deep and some are just on the surface. And is there any reason why some of them are skin deep and some are on the surface? Or is it that the longer you've had them, the deeper they get into the skin?
The major reason is still, I'm back to sun exposure. The more because it's actually exaggeration of the pigmentation. Now, our skin has two layers. Most of our pigment cells are in the uppermost layer. And also with sun exposure, the pigment cells get bigger and then they get actively producing the melanin.
Yes.
So some of them drops into the lower layer. So the deeper the pigments are, the more active they are, the more severe the pigmentation on the face, the melasma.
So are you saying, I'm just asking, does it follow to say that the melasma is like a buildup of melanin, or is it?
Well, I would say that it's abnormal production, overproduction, abnormal production, and excessive activity of the melanin pigment or the melanocyte producing the cell, which are the cells producing the melanin.
How does contraceptives affect it? How does estrogen affect it? Maybe estrogen progesterone cream or estrogen menopause affect it? How do all those things?
Melasma is one of the causative factor is stimulation of hormones that enhance production of melanin. So estrogen is one of the hormones that can stimulate other hormones that enhance production of excessive melanin. So that's one of the ways it just enhances the other hormones that produce pigments.
Talk us through, take for instance, the treatments that you have talked about now. Can you talk us through one of the procedures to see how, one of the procedures we can use? I mean, you've mentioned them. Talk us through one of the procedures, let's see. Okay. Take for instance, do they have the laser in Nigeria? Can we do the laser in Nigeria?
Yes, there are places that have the laser in Nigeria. It's not, it's expensive though, yes, and it's not common, but there are places you can
hold that thought. Don't go anywhere, we'll be right back. You're welcome back. If you're just joining us, I have Dr. Lushola Ayalowo, consultant dermatologist with Luth, and the senior lecturer at University of Lagos. And she lectures on dermatology and genitourinary medicine, and we've been talking about melasma. What is melasma? Melasma are those dark patches you have on your cheekbone, some on your chin, some on your forehead. And a lot of women would say, thank God for concealers, including, because if we didn't have concealers, only God knows what some of us would look like. You're welcome back. So, Doc, talk us through one of the procedures of how to treat melasma, because you find out that some of us who have melasma, we try different creams and we don't have the patience. And you have talked about patience being one of the ways to be able to stay with treatment. Because personally, what I do, I find one cream, it clears, I find another one, I jump onto it. Do they have creams, like creams specifically targeting melasma? 1, 2, talk us through like a procedure to treat melasma.
Okay, there are creams and there are cream mixtures that target melasma. And then sometimes when we treat, you can say that, okay, you do both the creams and the procedures together. So it can be a combination treatment. Now, one of the most common procedure we do is chemical peels. What we're doing is trying to, it's sort of I would say in a layman's language, sandpaper in the face. And as you're in a very mild way, under very controlled condition,
yes,
you're removing the top layers and you're encouraging the lower layers to grow up. And as you're doing that, along with the creams, you get to the layers that have the pigments, and then that also goes off too. Of course, alongside as you're doing this procedure, you're also maintaining meticulous sun avoidance and sun protection. Of course, we know that there are other things that look like melasma that are not exactly melasma. For example, the people that have been on photosensitizing drugs. There are some drugs that, if you use them with the sun, they can also produce what looks like melasma. And then some people that use prolonged use of hydroquinone containing lightening creams, they have what looks like melasma, not exactly melasma. It's called exogenous ochronosis, and that looks like melasma. Treatment is pretty the same, but it's not exactly melasma. So,
you've talked about, okay, outside of sun avoidance, you talked about like now prolonged use of hydroquinone. Outside of, now we're talking about lifestyles to avoid melasma. So outside of sun, what other things, lifestyle, can we adopt to help us avoid this melasma?
The other lifestyle is not to just use drugs. We're so used to, we have headache, we have this, we have that, we go to the over the counter and then just buy drugs. I told you that some drugs can cause melasma. They can also cause photosensitivity. And that also enhances the melasma. A combination of melasma and the photosensitivity makes it worse. So another attitude one has to develop as a lifestyle is to not just use drugs. If you're using drugs, ask, is this drug photosensitizing? I mean, if you tell your doctor that you have this issue with pigmentation or you have this issue with photosensitivity, and they can give you alternative drugs that will not pigment your skin, or tell you to use these drugs in the evening and not in the morning.
When the sun is not high.
When the sun is not an issue.
So, because even when you're in the car and you're driving or you're in front of the car and the sun comes through the windscreen, it has the same effect.
It has the same effect, except you have if you're using your car has it's tinted,
yes,
and it has UV filter. Okay. There's some tinted cars that have UV filter. So except you do that, even with the driving in sun, the sun hits you.
Yes, it's true. The sun hits you.
It has the same effect.
Okay. And how does using like harsh treatments affect the melasma? Because sometimes we are so frustrated and desperate in having that melasma that we try all kinds of things. How does using harsh and trying to remove it, like they say, by fire, by force, how do all those harsh treatments affect it? Do they affect it adversely, or how do they affect it? Do they make it worse? Or?
Of course, they make it worse because some of the, I think the key is to go to the professionals, people that can do it for you. Mm-hmm. I know melasma looks like it's a cosmetic problem.
I used to think it was until I saw a dermatologist.
It's not just a cosmetic problem. It's also a medical problem because it also borders on your quality of life. You feel bad, you can't face the wall, you feel stressed, even knowing that your face has blots and patches. So the key is to go to the people that will do it correctly for you and then stick to their treatment. Compliance with the treatment is the key.
Once again, what word are you going to leave us with on this melasma? Well, I know it's not a death sentence. Oh, thank God for concealers. I always say thank God for concealers. So what word are you going to leave viewers with? Because I know that a lot of women, the men, I don't think the men really care, but lot of
men do.
Some men do. A lot of women really care about melasma on their faces, but thank God for concealers. So what word are you going to leave us with?
The first word is that to say that our face is as passport, and what we do with our face in the long run borders on our health. If I just buy creams and things over the counter, I buy drugs over the counter, that can affect my face. We also have to practice a culture of sun avoidance. Sun is our friend, but if we have too much of it, can affect us adversely. We don't just assume that because we have dark skin that I can just walk in the sun morning to the evening. If I don't have any business in the sun, then I should stay indoors. If I must be in the sun, I can use sunscreen. If I must go to the sun, I can use umbrella. I can use a wide brim hat. It's not about developing a culture of sun avoidance. And then for people that need to use drugs that might be photosensitizing, they need to discuss what they have with their doctor. The doctor gives them an alternative medications or tell them when to use it and how to use it.
So are you saying that if you have melasma, the best thing, stop trying to treat it yourself, just go and see a dermatologist?
I think so. Because it's not just, it's deeper, it's not superficial. If it's superficial, most cosmetic people would have been able to sort it out for you. So it's a combination of treatments, and you also need to be monitored, just like any health issues. So you need to see the person that will do it best for you rather than doing trial and error.
We do trial and error in desperation to get it
and
out.
of course, sometimes you make it worse. A lot of times you make it worse.
It's true. It's true. Doctor, thank you. Thank you so very much. I appreciate your coming. Any fallout from this, I'll invite you to come and talk to us about it. And anybody who wants to know where to find you, you let us know where we can be contacted, because I know that a lot of women are going to point to see you to get their melasma off their faces. Thank you very much, Doctor.
You're welcome.
Thank you. Viewers, you know that patch on your face, you know what it's called melasma, and you should try to avoid to do it yourself, because now that you know what it is, it's a combination of so many things. So we'll get to find the experts to get rid of it on our faces. But in the interim, we thank God for concealers that keeps helping us to go out of our different homes. Until I come your way another time, thank you for your time, and this is My Factor. Goodbye, and God bless.